now on IPL on 0413 636 024. Get in your song requests. Can request to be on the show. Enjoy. That is 0413 636 024. IPL Radio. Only the best. IPL Radio, inspiring passionate lives for the community.
Oh, and welcome
there we
back.
are. Well, welcome back.
Pause there. We just nearly interrupted you, man.
We did.
It is testing. It is one of those wacky Tuesday afternoons.
It definitely is.
But
I don't think that you.
yes, they are.
You don't have to wear your earphones if you don't want to, you know, because we're actually like in the same room and we're next to each other, talking to each other. So,
Yeah, but I like it. Looks professional.
do you want to have mine?
All right, let's get back to some serious business. We've got Megan Nielsen, who's here. She's from South Coastal Women's Centre.
Megan.
Hello, how you
How are
going?
you?
Good, thanks.
And Megan is a health promotional officer, and she's here to talk about promoting the importance of cervical screening. Welcome, Megan.
Thank you very much. And yeah, I am here to promote the importance of cervical screening. It used to be called pap smears, so most people are probably familiar with that word, but we haven't actually called them that for 5 years, since 2017.
That sounds scary. It
Yeah.
sounds scary. It sounds better cervical.
Yeah,
Don't
yeah,
know,
we
don't
kind
know.
of
It does.
kind of have horror thoughts about
bit
that,
loud.
but we're still doing the same sorts of things when we're doing cervical screening. But basically what we're doing is screening the cervix. So
Yeah.
whereas pap smear was named after the doctor who actually developed that process, it's different because we're actually looking for the virus that can go on to cause changes of the cells of the cervix, rather than looking for cancer of the cells.
Oh, right.
Which is different and better. Why?
It's different and better because we know that cancer of the cervix is almost 100% preventable. It's not something that runs through the families like lots of people believe. It is actually caused by the HPV virus. Now, that's the needle against HPV that kids get at school in year 7 or year 8. Boys and girls get it to prevent the HPV virus. And that one prevents up to 9 types of HPV or wart viruses, same as what we get on fingers and toes. There's specific sorts that can cause changes to the cervix, and it also causes changes to other parts that are used in sex. So there can be throat cancers, penile cancers, but in particular we're looking for cancers. Well, we're preventing the HPV virus for the cervix.
All right.
Okay.
Yeah.
So like, I've got a couple of questions. Like I read up that you're trying to eradicate this like 15 years. Like,
Yeah.
is that a true
That
figure?
is true. Well, the government says it's true.
Yeah.
These days, now that kids, the majority of teenagers are getting the vaccination when they're 13 years old, before they're sexually active for the majority, then they're not even passing on the high-risk HPV wart virus. So then there is still a risk of changes of the cells from lower risk viruses, but far less. And what we know is if anyone gets warts, even like fingers and feet, we can treat them. Well, they usually go away in 2 years. So what we're looking for is when we're doing cervix screening, is we're actually looking for that wart virus. If it's there, we will continue to keep track of that, make sure the body clears it. But the difference between getting the HPV virus and going on to cancer takes 20 years.
Wow.
So if we can do something about cells before they even change, we're not going to have cancer of the
Prevention
cervix.
is better
So
than cure.
that's the sign from warts, is it?
Absolutely. So
Wow.
Australia is probably looking at being the first country on top of this. So it'll be eradicated if all women aged between 25 to 75 are up to date with their cervical screening.
Wow.
Yeah.
Who's more at risk?
The women who are most at risk of getting or dying of cancer of the cervix are women who are underscreened or never been screened.
Okay.
That's the chief one.
So if you go in,
Yep.
and if they find something, is
Yep.
it straight away cervical cancer, or is it
No,
getting there?
absolutely not. So if you go in there and there's a little brush that touches your cervix and the little cells are sent off to the laboratory, if it comes back and says you've just got the wart virus, then the laboratory will determine whether you need to just be checked in a year, or and if your body clears that virus, then you can go back to having your cancer screen every 5 years. So it used to be 2 yearly, now it's every 5 years, which is
So
a
I
big
got
relief
one
for all of us.
I got one, I think it was last year,
Yep.
the year before. So,
Yep. And if you're all clear,
yep,
you don't need one till
another
3 years, probably 5 years after your last one.
good to know.
Yeah. So the women who are have either never had one from the age of 25 or are well overdue, they're the ones at more at risk.
Okay.
The sad thing is that we know that women of Rockingham, Kwinana and Mandurah are under-screened. So we are more at risk than the general population of Perth and of Australia because we just haven't got out there to everyone get screened.
So just
Okay,
as
that's
a
why you're here today.
Yeah.
okay. Just as a naive question, right?
Yes.
Maybe a male. I don't know
Yep.
a lot about the screening stuff and that.
Yes.
Is it painful to be screened?
No. So it's kind of embarrassing because you're exposed to a stranger, because the nurse or the doctor does need to look internally, but it's not painful. It's just a little brush has touched your cervix, and they need to use what's called a speculum, so it looks a bit like a duck's bill because they need to get in to have a look. It's like any other part of our body. We can't see this part, so we need to have a look. It's not painful, and honestly, it takes 2 minutes.
It was a very professional sort of experience for obviously for the girls that have it done.
Absolutely.
See, I think that's coming from a generation that gets scared easy by invasive things.
Yes.
I can well imagine the girls will be going, "Ooh, I don't want to
Yeah.
get it done because somebody has to see my bits, or
Yep.
somebody. It could be painful. I've heard it hurts and
Yep.
stuff like that." Well, like you say, it from your words, it doesn't hurt.
No.
And it's quite a quick experience.
It is.
And
Yeah.
obviously professionalism. The doctors don't go talking about it and stuff like that. And
No, so the important thing, is to find someone that you're comfortable with, whether it's your own GP. There's nurses that can do it. Where I work at South Coastal Health and Community Services, which is sort of between Ace Cinemas and Centrelink, there's a doctor, Dr. Angela, who can do it every Tuesday. She also has an Aboriginal nurse who works alongside her, and there's plenty of other nurses there who can help hold a woman's hand. She can bring a friend in if she needs to, so there's plenty of support available.
I think what Decka was saying before about the generational thing, I remember when it used to be called the scrape.
Really?
Yeah.
Yeah.
It was
Before
called
pap smear.
before
I
pap
remember
smear,
that.
it was called
Yeah.
a scrape.
Yeah.
Now the thing is, when it comes down to kids being frightened of it, who's going to want that?
exactly.
Yeah, that's why it sounds better.
Exactly. and that-
Yes.
Yeah, exactly.
Yeah.
So it's kudos to the people who are doing it now to actually understand that was a flag and do something about it.
Yeah. The other important thing is that everyone should get it every 5 years until they're 75, and that's regardless, as long as they've had sex at some stage, regardless of if they've only ever had one partner, if they're lesbian, if they've had multiple partners, because the virus can stay dormant in the body for many years, so it's important to keep going back every 5 years. So even like the age group that's least screened is 50s onwards, because we just could kind of get a bit blasé and think, well, I've been with the same person all my life, don't need to, but these people are at risk as well.
I've just got a question. You mentioned about 25 to 75-year-olds. I've got two daughters, 18 and 20.
Yep.
What about, I mean, because obviously I want to make sure that they're okay. Are they at a lower risk because of their age, or how does it work?
Yes, if they've had their vaccinations, they are at a lower risk. But the other thing is, if any woman does have symptoms, so if she has any bleeding at all, then that she doesn't go just for a screen, then it's important to go to the doctor
What
to
are the
find out
symptoms?
what's going on. So it would be irregular bleeding.
Yep.
So bleeding between periods or bleeding after sex, painful sex, they're all indications that maybe you need to see a doctor and get things
Well,
followed
that's
up.
probably what we really want to get out there and
Yep.
make them aware of. Is
Yeah,
that there?
Yeah. So if you do have any symptoms, go and see a doctor. If you don't have any symptoms, have your 5-yearly screen.
Okay.
And if you're
That's my bones.
under the age of 25,
Yes.
you should be looking at getting the vaccine, right?
Under the age of 25 years.
Yes.
You can get it older, but most people by then have probably already been exposed to the virus. So they tend to think, well, it's not really relevant to have that vaccine. It's just more relevant to make sure you have the screen every 5 years.
I'm just going to make sure that my girls have had the vaccine, because to be honest with you, I'm not too sure.
Did they go to high school here?
Yep.
Then they probably did if they had vaccines in year 8, year 7 or 8. Yep.
All right. Okay. Crisis averted.
That's it, yeah.
Yeah.
So, Megan, what do you want to get across? Is there anything else you need to get across? Like, just because we all know that it's a little uncomfortable,
yeah.
but it's a necessity, isn't it?
It is a little uncomfortable. It is
So-
a necessity.
uncomfortable, but it's like it's good. It's every 5 years now instead of every 2.
Absolutely, and really,
So-
it's not as bad as people anticipate. I do perform the screen, and I just keep chatting away to people about all
Yeah.
sorts of things, and then it's over and done with, and we're done. And I encourage them to come and get a coffee and cake for being brave.
That's it.
So promote the shops.
I'll be there.
Yeah, free lollipop and a smile.
Yeah, that's right. So it isn't painful. We do feel embarrassed about it because we feel vulnerable, but it's really important. There's a poster that was put out saying, "Don't die of shame, don't die of embarrassment. We can prevent this. We can get rid of it in Australia."
Well, we'll put this on Facebook. And
That'd be awesome.
You can put it on your Facebook page.
Absolutely.
whatever
Thank you.
need to.
Thank you.
Yeah,
And if
that's
anyone
okay.
ever needs to book in, Dr. Angela at South Coastal Health and Community Services.
Okay, thank you.
Perfect. Thank you.
Just before you go, have you got a favourite song that you would like played on the radio?
Oh my goodness me, the choices. How about Hunters and Collectors? Throw your arms around me.
Holy no, throw your arms. Yeah, I love that.
Hunters and collectors.
Yeah.
Ooh, let's have a look.
Bit showing my age
Let's
now.
get started.
No, well, we've got two options. So one, Decka can find it, or we can get Fatima to sing it.
Well, I'm liking how she's going.
So there, but it looks like it might be coming. In the meantime, I'll talk about things because I don't talk very often. Yeah, no, it's interesting what you were saying, and I think about when it comes to my daughters, as I said, 18 and 20. Yes, they will have got the vaccine, but whether they knew what it was for at the time is something different. So when it comes
That's
down to
true.
that 25-year mark, is then do they know that they have to keep it going? And that's why what you're doing is so important now.
Yeah, it is just really
just
important
like
that we're onto it.
It brought awareness to him.
Yeah.
Yeah.
Well, not him, to Mike.
And whether,
Sorry.
and it's relevant, it's just as relevant for men as for women. Women get really busy. We're looking after our families. We're working. We need to take time, 5 minutes for ourselves.
You want to introduce the song in a
Well,
second?
hang on, I just forgot to ask. You say the girls get the vaccines at year 7. How old is that again?
It's about 12 to 13. It's in
12,
year
13,
8
right.
now.
Yeah, because we've got different years and stuff in England, and
Yeah.
I still can't comprehend
Can't get
all
your
that
head
stuff.
around that.
Yeah.
So about 12, 13-year-olds
All right,
get the
yeah.
vaccine.
My daughter's 10, so
Okay.
another couple of years for her.
Couple more years, yeah.
All
All right,
right,
Megan.
yeah.
Okay,
Introduce the
so
song.
here's Hunters and Collectors. Throw your arms around me. Woo!
Enjoy.
And this one is for Megan. Thank you very much for coming in, Megan, talking
you.
about cervical screening. And ladies, if you haven't had yours done recently, book an appointment. It's free. It
Dr.
doesn't hurt.
Angela.
Go and see Dr. Angela at the South Coastal Community Women's Centre and get it done.